do know that we're within the period, and just the latter part of Tuesday, we had, I don't know, amalgamated teacher unions, you know, coming forcefully to detest any attempt by the Ghana Education Service, with its oversight ministry, the Ministry of Education, and generally government, to try to tinker with the idea of opening schools for basic as well as senior high school and even tertiary. And they forcefully put that in the statement. We'll put the statement on the screen for you. And you get to know that comprehensively what they are saying is that, look, if you benchmark what the situation is, not only in Ghana, but with the rest of the world, there are too many indicators giving us all the inclination. Look, we can fail if we just open the Pandora's box. We want to have a ranking on Parliament Education Committee on the line. Dr. Apaak, he's on stream, and we're zooming him. Good morning to you. Deputy Ranking, Dr. Apaak.
Yes, good morning, Roland.
How are you, Solu? Solu.
Good morning to viewers.
Solu.
Solu Nalonwa Kubasa.
That's why I fail. Okay. And I'm sure.
You say Solu Nalom.
Solu Nalom. Yeah, it's a long time. You've given me some pito, so it's been a while. I've forgotten my lines. But
you're not a bull, man. You don't have to worry yourself. He's bothering you with bull this morning.
Now, let's get to the basics. And you have read a statement of the 3 teacher unions, and subsequently other statements coming from think tanks. What do you make of it? The position of the stakeholders out there.
Well, first of all, let me say thank you for giving me the opportunity to share my opinion on what is going on in the educational sector, and what the information that has come out to the effect that, you know, plans are being put in place to consider reopening schools by the end of this month. I must say off the bat that I side with the teacher unions who have now been joined by the Private School Teachers Association and indeed the National Council of Parent Teacher Associations. They have a legitimate case to make. And I believe very strongly that if you look at the dynamics that we are dealing with currently, and you factor in the nature, architecture, and systems that we have in as far as our public school system is concerned, vis-a-vis this pandemic, and the lack of what I would describe as adequate preparation, even within the context of frontline health workers and their needs, it makes it very difficult for any teacher who truly cares about students, any parent, rightly so, who would naturally care about his wards, to say that schools should reopen when we have not seen anything concrete being done to ensure that if schools are indeed reopened, whilst we are still contending with this pandemic, we will not end up exposing students, teachers, and non-teaching staff to the coronavirus. For example, just a few quick examples. Even before the advent of COVID-19, you and I and many other Ghanaians were fully aware of the challenges that we were facing, particularly in the secondary school system and the basic school system. Secondary school system, for example, we have been contending with issues to do with space. Space in the dormitories, enough spaces in the classrooms, enough spaces in the dining halls, and what have you. And so how are we going to address this challenge when we are dealing with a virus that requires that we maintain physical distance, or if you like, social distance? A virus that will require that in as much as possible, you know, we avoid interactivity. So these are practical issues that must be considered.
Okay, just just be on stream. Now, Seth, let me ask you. Look, we're practicing double track. We can still do that. Have even a 4th track, a 5th track, where we decide to space out the students segment them in 4 or 5 groupings, and we'll still have a good educational system in the public level.
I mean, Roland, a while ago I ended my last commentary with the beauty of democracy. It's sharing of ideas. Nobody is sitting with any decision cast in stone. No, it's still a conversation. And we have to understand the managers as well. You should understand the economy we live in today. It is not easy. And we are not an isolation in the globe. People are taking measures and steps to ensure that we get children. Look, day in, day out, we are maturing. Time is passing us by.
So you're discounting the concerns of the teacher unions?
They
have a grouping
and
a membership who sits in the classrooms, and their experiences indicate that, look, it's just not good enough if you're tinkering with the idea.
Nobody is tinkering with any form of idea. We follow the measures that would help us maintain good health and public safety for our people. Who asked that the schools to be closed? The same administration. For what reasons? To protect them and make sure that lives were fully and well protected. Nobody will rush into throwing wards and children back into school. Let's sometimes remember that the people who manage and take these decisions are parents themselves. And so we should not for a second assume that somebody is living somewhere on a different planet and do not appreciate the times we live in. Every decision, every action that have been taken is well thought through before we arrive at a decision. And so it is good. But this behavior and attitude of rushing to the microphone sometimes, excuse my language, I think it's not helping this country grow. It's not helping this country grow the least.
You're saying parents, teachers,
I'm not saying
and those who are administrators of school don't have a say?
I made
a key concern.
I made a very useful...
And that the only person with wisdom are those serving in governance and the structures.
Below the point. I never said so.
Okay.
My concern is this. Remember that the managers themselves are parents. And they would never take a decision that will affect the lives of our people. Every step we have taken in this exercise has been in the interest of our public safety. And that is key. We shouldn't lose sight of that fact. It is good to express ourselves and demonstrate our intentions so that everybody can buy into. That's why I said that is the beauty of democracy. But that shouldn't be an enforcement. And like I'm saying, we are not the only country who is running an educational system. In some areas, in some countries,
South Korea,
some level of students have been asked to go back to school. And so we should appreciate this. We shouldn't just be sitting back and fold our hands and sit back and think that manna will fall from heaven. It never happens this way anywhere.
Well, we've been told.
An economy.
The World Health Organization says that, look, we have to live with this. Schools, well, for private schools, maybe the parents can impress on the administrators, the owners of the schools to do that. But for public schools, well, you can just imagine.
Imagining
Kajano 1, Kajano 2, Kajano 3, Kajano 4.
Imagining what will happen is the reason why the parents are raising the concern. Imagine Kajano 1, 2, 3, 4, and their students are gathering at school, coming from different areas, with different homes, whose parents probably have been exposed, whose parents are traders. So that is why they are raising the concern. You see, globalization has brought to the fore the need for all of us to cooperate and to learn from others. France reopened. They are shutting down again. Because the first day they opened, about 70 students caught the virus. So they are shutting down again. Now South Korea is doing it gradually. South Korean class size, even before COVID-19, was significantly lower than our class size. So
China has
a
big
opened,
population.
but big population, but class size low. Class size. Even China in Wuhan, when they opened and the second wave came, they decided to do what? To test the 11 million people in Wuhan. 11 million people in Wuhan. So you need resources to be able to do that. Now, you see, why we are worried, my dear brother said, is that the World Health Organization has also warned that African countries have weak health systems. And because we have weak health systems, if the pandemic's full force is felt in Africa, the impact will be disastrous. And that because we have weak health systems and we are not yet facing the full force of the pandemic, we should do everything to contain the spread of the pandemic, because our hospitals, our health facilities will not be able to withstand. And we are also poor countries. And that is why for African countries, prevention is better than cure. And that's why people are concerned. And so for me, our educational system is already stretched. I mean, without COVID-19, our education, barebacks were killing students.
No, but we have good private schools that tend to complement others.
Well, I think that the government is talking about public schools.
Yes, we're all talking about public schools.
The government said it's reopening schools.
No, but they're collating the ideas. That's how it's
No, but the point is that it's work in progress, and you have to understand that at every stage
they should first of all kill the barebacks.
There will be a decision out there.
They should kill the barebacks first.
And so.
Because before they
you're saying that we're putting the cart before the horse.
Certainly.
Right.
Certainly.
Okay, Dr. Apaak. So
yes, Roland.
So you seem to be siding with the parents and the unions, but the reality is that once we have to live with a certain disease, we have to do things in such a way that we live within our means, while also we get society going. The kids are home, chopping free food, having an impact.
Not necessarily.
Having an impact in the pockets of what is available by way of monetary resources in the home. It's got a lot of significant effects. While also they are losing good education.
Roland, don't get me wrong. Don't get the parents wrong. Don't get the teachers wrong. We would all wish that we can get back to normal. Our wards can be in school, learning to take over from where we live off. But we must also agree that we have a situation that we must contend with. And I was glad that Honorable Idris Husseini made a reference to what happened in France. Now, look at their conditions, look at their facilities, and the fact that after reopening schools, what occurred. And then compare that to what we have here today, where even we've not been able to fully satisfy frontline healthcare professionals with their needs with regards to the PPEs.
Look,
is it the case that, for example...
No, don't give him that floor. please. You are talking specifically on education. He's playing politics. He just needs to straighten his language. I don't want to come in. He's not in studio with us. No, he should be speaking education.
So what do you
want? Jump onto frontline health workers. That's a different subject. We are not here for that. No, they are not. Speak as a parent, speak to the world what you want us to do for the children. That is more critical. And stop government not being able to meet the demands of frontline health workers.
Okay, it's okay. That's why I moderate this program. So let me come in. Dr. Park, hold your horse. You two hold yours as well. So hold your horses. Now let me ask. And this one just in 15 seconds.
Right.
Yeah.
The teachers, when we're going to deploy them to the schools, back to the schools, they'll still need PPEs.
Sure.
Well, some form of PPE, not fully, at least nose masks.
You're wearing a localized nose mask.
Yes.
I'm wearing one.
Yes.
This is homegrown.
Okay.
We are developing a homegrown industry.
Okay.
This is leadership.
Yes. But he's alluding to the fact that consistently we tend to have...
Show me wherever on this earth.
We tend to have shortages even at the health front.
Since the outbreak of this pandemic, who've ever had it all through and become the best and got everything right? None.
Yes, true.
None.
That's why the cases are flying.
It took the world by storm.
But the cases are flying all the same.
Roland.
Yes, sir. Dr. Park.
Yes, very quickly. He wants me to focus on education.
Yes, you should, because he says the pressure is not as much as the health sector. I mean, which is logical.
No, we are not speaking in a vacuum. I am only alluding to the reality. And I was to compare that to what happens if we have instances, and how do we monitor to ensure that teachers and students are safe. They will need that. They will need nose masks. They will definitely need sanitizers. Wouldn't they need those? They will have to get Veronica buckets located at vantage points on the campuses with running water, so that they can also abide by the protocols, including the social distancing that I spoke about.
Okay,
but in any case,
Dr. Apaak.
So the intention
Dr. Apaak,
that before the students go to school, they will be tested. Would the teachers also be tested? And are we going to have a mechanism in place where we would activate the healthcare units? Because every school is supposed to have at least a nurse or a healthcare professional there with some basic, healthcare supplies to be able to offer assistance to students who may have one ailment or the other. As I'm speaking to you, that is not the case in all of our schools. Are we going to activate all of those? So the point that parents and the point that the teachers are making is that, yes, we should be thinking about the best way forward in dealing with this matter. But it is too early for us to start looking at opening schools when we have not even prepared a document. You write to the teacher unions, they receive the letter over the weekend, and you are inviting them the week after to propose ideas about the way forward. Are you even giving them enough space to be able to make proper input?
Why not?
All of these questions that we need to discuss.
Why not?
Do we need a year to do this?
So look, at some point in time, we have to come to a head. So 2 minutes each. Let me start with Seth. Okay. Seth wants to have the floor.
No. The point is that
you've been dominant.
I've been listening to Dr. Apaak. Areas where they deployed and returned students to school. We have various classes of schooling. They did not just start with basics. They started, sometimes they look, if it's a university campus, that they can seriously manage them well. We need to get our lives back. So they look at the various segments where it's applicable, then they deploy. When they begin to see their challenges, they withdraw them. So they said teachers must proffer solutions. Me and him, our national service personnel are not coming to work in Parliament. Our parliamentary service staff are on rotation. And so every sector of the economy is doing some level of engineering. If we've written to them, this is akin to what is happening all over the world. We should not just jump the horse and say, we will open all schools for all children to come. Have you got the funds to even cater for the lives we are going to throw out there? No. We are today protecting ourselves. Do you think locking down is the pleasure of any person? No. But how do we manage ourselves?
Right. Now let me ask a question. Do you think that the state authorities ultimately know that we have to open, and so that's why they are doing that? But they are trying to create a certain scenario of normalcy so that other things can go on.
No. You can't create a situation of normalcy now. It will be irresponsible to try to create a situation of normalcy now. But what nations are worried about is how long this lockdown or closure of schools or the banning of economic activity should continue.
What do you say?
Yeah, it's a big concern, it's a big worry. Now, because you see, you have your kids. If they're in private school, they might be better. Because the private schools have instituted the Zoom learning. So if your kids are in private school, they are going to school. Albeit the contact with the teachers is now through the internet. But the public schools, there is nothing. They are sitting at home. So what do? That's why countries are thinking.
What do you think we should do?
No, I'm saying that in this case, opinions must be backed by science and data.
Okay.
So
what's
that's
your
why
opinion?
Nations? No, I don't have an opinion in this matter. I just think that you should look at the science. You should look at the data. And you should look at the experiences of other countries. What other countries are doing is gradual, conditional, easy return of students to school. Gradual, because whatever be the case, we must be working towards a return. The world cannot be in this situation.
Okay, so you back a return. You say that, look, let's go back to school, but in small bits.
In small bits.
In small bits, yeah. That's the same thing. I think this is a good headline for myjohnline.com. The Member of Parliament for Tamale Central. Dr. Apaak, in 10 seconds, reopen or not reopen in small bits?
Well, we would all want our wards to be back in school, but it must be done in a way that would reassure parents, teachers, and non-teaching staff of their safety. But as I said, you know, those in the middle of the theater have indicated that it is a bit too early. And I think that, you know, the ministry should engage them a lot more aggressively and give them some reasonable time for them to also proffer what they think is going to be the best way forward.
What do you say? What do you say in one sentence?
Well, what I'm saying is that there needs to be a dialogue between the government and the teacher unions about the way forward in as far as the discussion about when to reopen is concerned. Reopen, we all want it to reopen, but it has to be done at a time and in a manner that will not endanger teachers, students, and non-teaching staff.
Great. I think you should have started this way, right?
No, remember that.
It's okay. It's not for debate. Dr. Clement Apaak. Busa South.
He's a member of parliament, so he knows how to run his mouth.
Yeah, thank you very much. He's also a known educationist. I remember he used to work at the University of Ghana. And
not only University of Ghana, he actually
Seth
taught.
Champo, member of parliament from Price.
He actually taught for a long time in Canada.
Now,